Obviously, the majority of people, they get up, they put on CNN or MSNBC or Fox, and they think they're, learning things. And they're really being filled with messaging that is very part of our establishment narrative. It isn't like necessarily an advertisement. It's really ingrained in our narrative. And so can you explain like what kinds of things you would be talking about and the message you were wanting to get out to combat? I mean, I was just reading a little bit about what you had said from, again, with Michael Moore's movie and what was going on in the background. But what kind of messaging are you trying in that industry to put out to sort of scare people away from what we know would be our best interest?
Well, first of all, you spend, and they have spent decades on propaganda campaigns to make people think that insurance companies are necessary and to get them to fear any kind of change that might have a detrimental effect on their bottom lines. The part of this, by the way, is efforts to get people to fear their own government, to dislike or have less trust in the government. That's part of what they do. And it's background. We don't really know where this is coming from, but know that a lot of it is done behind the scenes. And they fund front groups. And that's a big part of the way that they operate. There's an organization that's based in DC that's run out of a big PR shop. It's and the front group is called the Partnership for America's Healthcare Future, and that is their current front group to try to scare people against any kind of progressive reform, whether it's in Washington or the state capitals. There are a number of states that this year are trying to pass legislation to create a state-based public option, and this partnership has affiliate groups at the state level that's doing the dirty work of lying to people. They raise fear. In fact, all these campaigns are based on something I call fear, uncertainty, and doubt. It's not my acronym, FUD, but that's what it's based on. FUD stands for fear, uncertainty, and doubt. They want you to fear change. They want you to feel uncertain about it and to doubt that those who are proposing reform are on your side. They will try to make you think that your taxes will go up. And obscuring, for example, if Medicare for all were to be enacted, we would all pay far less for our health care than we currently do. It's publicly financed, so yes, it's financed through tax dollars, but we would not pay premiums, which go up every single year, nor would we have to pay a lot of money out of our own pockets. They obscure that. So part of it is dealing in lies and half-truths and obscuring important information. They try to make you think that jobs will disappear if change is enacted. So it's all based on fear-mongering. They're fear-mongering campaigns, and they are financed with our money. They skim money that we pay in premiums to fund these campaigns.
Yeah.
We're speaking with Wendell Potter, author, former executive at Cigna, and now a noted whistleblower. Wendell, I think it's very important for people to understand what actually goes on inside the halls of Capitol Hill. Nobody lobbies our representatives more than private insurance and big pharma. If you could speak to what that experience is like, just knowing what happens to, let's say a representative in whether a safe district or a swing district, and is approached, basically by any representative, whether it be Humana, Cigna, United, and so on, and being asked, are you going to support this initiative? Because, we don't need anybody supporting a universal healthcare initiative. So how does that go down? What would that type of experience look like if we were to, role play, let's say?
Well, often it's through intimidation. On the other hand, they spend a lot of time developing relationships with staff members and with members themselves. And they contribute a lot of money to their campaigns, Democrats as well as Republicans. And that's how they get their claws into a lot of these politicians. They come to expect and count on these campaign contributions, and they're significant. You can look on at places like online at Open Secrets.
Open Secrets. Oh, yes.
And you can see just how much money these companies and this industry is plowing into these campaigns. When I was at Cigna, one of the things that I did was manage the political action committee, and we would often make sure that we gave as much money to Democrats as to Republicans. They can pretty much count on Republicans carrying their water. There's never very much concern there, but they still to keep that going contribute a lot to Republicans, but they also contribute a lot to Democrats. And the Democratic establishment has grown used to this, and they don't want that money to dry up. So this money that they give in campaign contributions buys you access. If you're a lobbyist for one of these big companies, you can be certain that you will have a chance to talk to staff, and in many cases, the members themselves. They will host receptions and raise money behind the scenes. If you go on Capitol Hill, you'll see nearby there are a lot of row houses that look like people live in them. They're at one point people did live in them, but now they're owned by lobbying firms or corporations.
So you're talking about those beautiful brownstones across from the Capitol are not actually residences. Those are more like where you show up to have tea and crumpets and try to wine and dine you. Okay, so yeah, that makes sense.
That's exactly right. And you can go on Capitol Hill, and almost at any time during the day, you'll see, at least between votes and committee hearings, members trickle out of the Capitol going into these townhouses because these lobbyists stage quiet fundraisers for them. So it's an enormous exchange of money that buys influence, buys relationships, and that is why it is so hard to move forward. The lobbying is intense. People don't have anywhere close to the amount of money, when I say people, regular folks, that these industries have. And during the debate on what became the Affordable Care Act, you mentioned the drug industry. They actually spent more money than insurance companies. The pharmaceutical industry spent more money during that debate than any industry had ever spent in a single year on a single bill in history. The insurance industry was right behind them. So enormous amounts of money was spent. And we know that, for example, that this is another way how it works. The original legislation contained a provision to create a public option. You may remember that. Yeah. But the industry knew that they could stop it in the Senate with just one vote. And they went to Joe Lieberman, who is from Connecticut, the insurance capital of the world, and they got him to oppose it. And he opposed it and said, I will not vote for this bill if a public option is in it. So that's how politics works.
Yeah.
I do think it's also very important to note, because as you know, the Democratic establishment, but especially the moderate liberals who live in the suburbs, they look at Obama like a lot of conservatives look at Reagan, like he's a saint, and you can't criticize him. What actually, from your perspective, did happen back in 2009 when, obviously Obama campaigned very hard on getting the public option into whatever potential healthcare bill we were going to have. And then once push came to shove, it ultimately was thrown out. Now, everyone wants to point the finger at Joe Lieberman. We all know that's a crock of it. That's not what really happened. That's what the media will let you know is what happened. But in terms of, what actually happened behind the scenes, from your perspective, why did, at that particular time, the public option ultimately not make it into the bill? And is there any reason to believe that something like that might happen anytime soon?
Yeah, to be honest with you, I'm skeptical that it will happen anytime soon. For the same reasons that it didn't happen 12 years ago or 11 years ago. The industry was able to communicate directly and many times with the Obama administration, with people who were in the White House, who were responsible for different aspects of handling the relationship with Congress during that debate. And you had people like Rahm Emanuel, who was quite eager to begin to cut deals. And the way it works is you have pharmaceutical companies and drug and insurance companies say, and the way they intimidate, the way they threaten is that if we don't like what you guys are going to be proposing, know that we will spend enormous sums of money to turn public opinion away from reform. So it's essentially blackmail. And all too often, politicians and presidents in the White House who you think would be liberal and progressive cave, because they just are not willing to stand up to these incredibly powerful special interests.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.